President Joe Biden was recently diagnosed with an aggressive form of prostate cancer. Between 2015 and 2019, the Mountain State reported more than 6,000 cases of the disease. A local oncologist is sharing the importance of screening and early intervention. Newswatch reporter Jillian Risberg has more information.
Prostate cancer disproportionately affects certain groups: older men over 65, those of African American descent, and with a family history. The American Cancer Society recommends men at average risk start screening at age 50, while age 45 for those at high risk of developing the disease.
In general, it's recommended that prostate cancer screening you stop at about age 70, but the decision to continue beyond that age should be discussed with your primary care provider and should always focus on what your risk factors are.
Generally, a slow-growing cancer. Up to 80% of patients are diagnosed in the localized stage and asymptomatic.
A small percentage of patients that may present with advanced disease, i.e. having spread to distant organs.
According to oncologist Dr. Barrett Campbell, uncommonly prostate cancer may present with lower urinary tract symptoms.
Difficulty voiding, dribbling at the end of the urine stream, or sometimes hematuria, which is blood in the urine.
The standard diagnostic tool is the PSA blood test or rectal exam to identify abnormal structures, nodules, or asymmetry of the prostate gland.
PSA, or prostate-specific antigen, may be elevated not only in the case of cancer but in non-cancerous conditions. The PSA is usually not sufficient to make the cancer diagnosis alone and should be followed with a biopsy of the prostate gland.
If prostate cancer is found in a biopsy sample, then the pathologist will assign it a grade.
The Gleason score is a very important factor in predicting how aggressive one's cancer is and determining the best treatment option.
The clinical manifestations of prostate cancer are wide. Some may present with aggressive features and others may not.
And not all men with prostate cancer need to be treated. If diagnosed in the early stage, it can often be watched without treatment in what is called active surveillance.
Survival for prostate cancer is generally good, particularly if you're diagnosed early.
Which highlights the need for you to have early discussions with your primary care provider about when to do PSA screening based on your own risk factors and personal preferences.
At Beckley ARH, Jillian Risberg reporting for Newswatch.